Let's start with the guiding principles of health systems. Especially in Europe, we take a lot of, or we give a lot of attention, and this is also coming from European legislation. This slide. We want healthcare systems with high quality of care. We want universal access. That means that two people with the same need deserve also the same quality of care, whether you're rich or poor or highly educated or not. And the third principle is financial sustainability. We should not waste the money in the system because otherwise we cannot guarantee in 10 or 20 years from now this high quality for everyone. We don't achieve it yet today, but at least it is still an objective, an aim in Europe to have those three principles. Now, to make them match together, the crucial question behind is, of course, we know we don't have all the money of the world to spend on health and on healthcare, and yet we want the best quality for everyone. So there is only one way forward. We have to make the best use of those limited healthcare funds. And so the underlying principle can be seen as maximizing the value for money by selecting the optimal mix of services, knowing that we have budget constraints. So that's what we call wise investments in health. We need to invest in health, but we need wise investments in health. And this is coming from the WHO already 10 years ago. All right. And therefore, we need health technology assessment. The simple definition of health technology assessment is it's a tool to review health technologies and to provide evidence of the value that these technologies can deliver to patients, their families, health system stakeholders, and to society more broadly. It's a quite broad definition, but I want to focus on the word value here because there is a lot of misunderstanding about that term. And the reason is that if you look at the Oxford Dictionary, there are three meanings for the word value. The first one is the regard that something is held to deserve. So the importance, the worth, or the usefulness of something. For instance, your support is of great value. I'm not asking how much I have to pay for your support. It's just that support as such has value to me. The second meaning is in monetary terms. For instance, this piece of land has increased in value, meaning it is now more expensive than it was before. And the third meaning in the dictionary combines both. The worth of something compared to the price that is paid or the price that is asked for it. For instance, at £12.50, this book is of good value. In other words, I like the book, and at this price, I really like it. Now, in health economics, and not everybody is following this, but let's say many prefer to use the word value for the first meaning. What is the relative benefit of a treatment, for instance, for patients or for society? And to use the term value for money when we are talking about the third meaning. Is it worth its money? Then we prefer to call it value for money. And HTA basically contains four elements. First of all, what is the relative effectiveness of a health technology? What some then call added therapeutical value, and so the added therapeutical value of that technology. Second, what is the medical need? And the higher the medical need, also the higher the added value, of course, of something new. And then the third is then the cost effectiveness. Is it value for money? And the fourth is the financial impact. Is it also affordable?